I had a pretty interesting case today of low back pain due to a disc injury the patient sustained last May. Usually when people end up in my office with a disc herniation, it means that conservative things have not fixed them. So usually there's courses of chiro, physio, and massage that have helped but not completely resolved their case. Usually when people fail physical therapy, it means that they have instability issues or ligament and tendon problems that have not fully healed. And just rehabbing the muscle or massaging and releasing the muscle is not going to fix them. Some important things too with disc herniations is that traction therapy should be your new best friend. I put a post out yesterday about hanging upside down. I had gravity boots on. I'm a big fan of using inversion tables, and I also use a specific kind of adjustment in my practice to actually straighten out and elongate and stretch the spine, which takes stress off the disc. Because if we look at the disc, it's like a jelly donut. If you tear the outside of the donut and the jelly leaks and pushes on a nerve, you're going to have local and radiating pain that can go all the way to your big toe. So we need to do anything we can to help suck that jelly back in, and traction therapy, hanging upside down or using inversion tables is a fantastic way to do it. Another big thing is you're likely compression intolerant, which means things like squats and deadlifts that compress the spine will likely flare your condition up. So I always counsel people on avoiding those exercises until we can heal and restabilize the area. Focus on hip thrusts, barbell hip thrusts, dumbbell hip thrusts, glute bridges. And if you are going to use a squat variation, the first thing I introduce is usually a front squat. It's a more upright position, it puts less load and shear forces on the spine, and it's all around just better for people that have chronic back problems. In the meantime, while we're healing and rehabbing people, prolotherapy is the best thing to restabilize a low back, because if you tore a disc, you likely have torn interspinous, supraspinous, iliolumbar, and SI joint ligaments. All those ligaments are likely damaged if you tore a ligament. The outside of a ligament, the outside of a disc is a ligament tissue. So if you have disc issues, you've likely strained and sprained those other tissues as well. So in short, avoid the spinal compression exercises. Traction should be your new best friend. And if you're going to reintroduce exercises, it's hip thrusts and it's going to be front squats when you are ready for them. Have an awesome day.